It is the start of a new year, and many Canadians across the country were able to ring in 2021 at home with their families. But for frontline healthcare workers, it's been a very different story. Many of them among those working as the clock struck midnight. They're struggling to get the upper hand on a sharp surge in COVID-19 cases. Hospitals in virus hotspots are losing ground across the country, and that is leading to major concerns about burnout.
We are absolutely in a public health pandemic crisis right now. We are seeing higher case counts, but more importantly, we're seeing more of a strain on the health system than ever before.
The situation is especially bad in Ontario, where they've had days of record infections and hospitals are now in a real crisis. As Sean O'Shea reports, some doctors are warning Canadians to get ready for a much tougher winter.
A new year, but a persistent pandemic, and one that is only getting worse, especially in hospitals and healthcare centres.
I think the people of Ontario should brace themselves for any possibility.
Coronavirus cases filled up Ontario's hospital in spring, trailed off in summer, but have been climbing steadily through the fall, spiking since Christmas. There are now 1,200 COVID-19 patients in Ontario hospitals, 337 in intensive care units.
This is really the heartbeat of our health system, and if we're saturating that, we are in trouble.
We should be taking this seriously well before these numbers were this high.
Behind growing numbers, real people who've lost their lives to COVID-19, like Jenny Ewan's grandfather, Chok Ping Lau.
My family is obviously very upset about this. Grandpa would have been there at Christmas time if it had been any normal year.
Ewan wrote about the Toronto nursing home where her grandfather died before Christmas, the Tender Care Living Centre. He was one of 52 residents to lose their lives in a COVID-19 outbreak.
The residents of these long-term care homes are people that built our country. They deserve a lot better. They don't deserve to be left alone to die on their own, even if it is a pandemic.
And this warning from the Ontario Hospital Association.
It's a very difficult position that Ontario is in, and the winter is looking like it will be brutal in terms of the fight.
In Alberta, with the highest hospitalization rates for COVID-19 in the country, tents have been set up to help treat patients.
It's a terrible, brutal, lonely way to die.
For people that might not have taken this seriously before, perhaps this is a wake-up call when you're starting to see your healthcare system stretch beyond capacity. And for example, hospitals, they're not able to care for people the same degree that they did before just because of the influx of patients with COVID-19 requiring admission and care.
Doctors are pleading with Canadians to do their part.
Please stay home. I know there's a strong desire to visit family and friends, but your decisions today can save lives. Wear masks, physically distance, and follow public health guidelines.
Even if precautions are taken, experts warn the worst days are still ahead. Sean O'Shea, Global News, Toronto.